So first of all, when we talk about cancer, we always talk about stage, because the stage of a cancer which governs the prognosis as well as the survival. So it is very imperative and important to diagnose them in an early stage. Now, gastrointestinal cancers, it's a very big branch because there are many organs involved. Primarily, it starts from the esophagus, which is a food pipe which connects from your mouth to the stomach. Esophageal cancers, they can be a gastric cancers. Gastric is a reservoir where the food goes into abdomen, is the first part. From there, there will be a small intestine, which is a very long organ, the longest organ of a body, which is around 5 to 6 meter length. Then there will be a large intestine. After large intestine, there will be a rectum, that is a stool bag, and there will be an anal canal. So if you see, it's a pretty long track, and the longer the track, the more the chances of getting diseases. So these cancers are pretty common. The gastrointestinal cancers are pretty common. And if you see, other than these luminals, this is called as luminal cancer because they are involving gastrointestinal lumen. There are some solid organs also inside the abdomen, like liver, pancreas, the biliary tree, retroperitoneum, vascular organs, so spleen. So there are many organs in the abdomen which can also have cancers. So it's a really a big specialty where many diseases are come under one umbrella. And every disease it's a long organ from the mouth till the anal canal, as well as the many solid organs in the abdomen. And so variety of cancers are present in the abdomen, and every cancer would need a different kind of treatment. Nowadays, all treatment modalities are divided into three main specialties, like a surgery, can be a chemotherapy, and can be radiation. And nowadays we practice something called as a multimodality approach, where we use all these specialties judiciously whenever needed, singly or in combinations with the various things. So it is very important to diagnose this cancer in an early stage. But the problem with the cancers, in basically GI cancers, is they don't produce symptoms. Okay, they remain asymptomatic, or most of the time symptoms are very, very, very vague. So because patients tend to ignore minor symptoms, and normally they'll end up in an advanced stage, the stage 3 or stage 4. And that's what when they get severe symptoms, and then they come to the hospital. So it is very important to diagnose them early to change the prognosis. So what happens mostly, if we look organ wise, the few organs produce symptoms pretty early, like you say, esophagus, a food pipe, because this is the only way the food goes down. The food is solid in the mouth and it gets stuck in the esophagus, and these patients get something called as dysphagia. So dysphagia is a very early symptom. So these patients, we diagnose them early because they have a symptom, or maybe a rectal cancers. There can be a bleeding from the anal canal or in the stools. So where these patients, we diagnose them early, but most of the cancers, as I told, they have very non-specific symptom, as simple as the bloating, the gas formation, the distension, the acidity, and these can happen to any one of us, and that's why we tend to ignore it. Second thing, as the cancer advance, the symptoms may appear, and most of the patients who get the symptoms are either in stage 2, stage 3, or stage 4. And these symptoms we should not ignore. As soon as you get some symptoms for the cancers, most commonly can be a loss of appetite, can be a loss of weight. Very common symptom with the GI cancers. Various symptoms like bleeding from the stool, blood in the vomiting, dysphagia, not able to swallow, not able to eat, the food getting stuck or choke into the stomach, can be a jaundice, a rapidly progressing jaundice in a short duration, any lump in abdomen, anything which is sudden severe distension of abdomen. So these symptoms are very peculiar about cancers, and we should not ignore them. As soon as we get these symptoms, probably we should consult a doctor and we should get it evaluated. They can be a non-specific symptom. It doesn't matter. You can just go to them, get it evaluated. There's nothing, you can relax back. But definitely, if you miss the bus, the prognosis will be different. So pay importance to your symptoms Do not ignore them. Don't take it casually, and probably that is the key to go ahead.